Okay, so welcome everyone. Today I'm going to be doing the presentation for Group CS 2411 on the proposal of our final project. This project is about telemedicine apps and the way it is meant to change the way we think about healthcare in Uganda. These are my group members: Ntabazi Vincent, and myself, Fear Ian, Machita Collins, and Senjiba Victor. So we understand that telemedicine, rather medicine, is a very important aspect of any economy, which boils down to if people are not fine, then the economy cannot progress. But we know as a country, we have big challenges in the healthcare sector from the fact that we have limited access and there's an overworked workforce because of the few doctors that exist and also the few healthcare centers that exist with the right facilities to take care of patients. We also realize that health also goes back to the SDGs, which are the Sustainable Development Goals, which involve good health and well-being. So in all of this, health is very important in ensuring that the economy progresses and everyone is very healthy and that do their part in the economy. So still, as part of Uganda, we see that very few people have access to a healthcare center, uh, and this makes up majority of the population. As we see, it's up to 61.73%, which caters for majority of the population. So this shows that a majority of people don't have access to healthcare at all. And then the doctor to patient ratio is also very low, which means that our doctors are indeed overworked. And doctors being mostly a profession where you have to be physically present, this is actually very draining on the side of doctors. And you also have long waiting times, the travel burdens, and also limited healthcare affordability because healthcare is quite expensive. And then this is where this uh, stands as the basis for our solution. Our solution is coming up with telemedicine application. This telemedicine application will solve greatly the doctor to patient ratio in that a doctor can serve multiple patients at once and not being physically present in order to assist them. Therefore, there's increased accessibility to healthcare. We also talked about in this solution as well, it brings a reduced workload in that you don't have to be physically present. It's also going to create shorter waiting times. This is because as long as you have access to the application, you shall get a doctor to assist you in a few minutes rather than waiting to walk there to the health center and then get assistance. This will also be more affordable since it's eliminating the cost of traveling to the health center and also offering insurance and other financial benefits to the users. So I'm going to invite my next speaker to take over from here. Thank you.
My name is Victor Ntengiumva, and I'm going to be talking about the features of the app and the objectives of the project that we are undertaking. So one of the features is going to be integration of health insurance to the users of the application, whereby they will be able to purchase insurance covers for different health aspects. And it's going to we're going to integrate a third-party organization into the application, which will help us cater for that insurance bit. Another feature will be the multilingual support. since the app is mainly going to be focused around East Africa, I think it's imperative that we include the Swahili language, which is spoken by most people in East Africa, that's TZ and Kenya, which will enable the app to have a greater reach across East Africa. Then one other feature is the offline access. The offline access functionality is essential for people that have difficulty with access to internet services, especially in rural areas. So this will enable them to get essential information, emergency contact without the need for internet. Then one other feature that stands out is the AI-powered symptom checker. This will be handled by also an API that will enable us to integrate a chatbot that patients can use to get preliminary medical advice and guidance through responses from the chatbot. One other feature will be remote consultations, which is a conventional feature for any telemedicine application, which enable to connect doctors to patients via video call without the need for physical access. My next presentation will be the objectives of the project. The main objective, obviously, is to design and implement the application to address the healthcare challenges. Like my colleague Ian talked about, there are several challenges that people face, long distances, waiting hours, and so on. So the application we are designing is to help those people solve some of those problems that Ian talked about earlier. Then the benefits of the project will be increased accessibility. This will bridge the gap between remote areas and healthcare. And like I mentioned, people will be able to access healthcare remotely via video calls or chatting with the medical personnel, respective of the queries. Now, another benefit will be the reduced workload, which will free health workers from having to travel to different areas, trying to attend to different medical conditions from different people, and also working on complex cases that are quite tiresome. So this will enable them to carry out all their activities in one place, on one platform, which is the application that we are trying to develop. One other benefit is the shorter waiting hours. This is majorly for the patients that usually go to the healthcare centers and wait for long hours just to get a consultation from doctors or other practitioners. So with the app, they don't have to wait long. They just schedule an appointment with their preferred personnel, the medical personnel, whereby they'll stipulate a specific time they want to talk to them, and with no time wasted, they can meet at the agreed upon time and get help from the doctors. One other benefit is the affordability. Since the medical consultation will happen remotely, meaning the patients can carry out the consultations at the comfort of their homes without the need to travel to the medical center. This will eliminate travel costs and other costs. It will eliminate travel costs mostly, which obviously signifies affordability. So thank you. That's my part, and I'll invite my next colleague to present the other parts.
My name is Ntawaze Vincent, and I'll be presenting my first part, that is about the significance of our application. The first significance, we can see that we are going to have enhanced accessibility, where we see that multiple people or numerous people are going to have access to medication and healthcare through our application, both offline and online. We have people deep in villages, different backgrounds, all of them accessing healthcare easily. Then we have improved health outcomes. So in this, the offline mode is going to be providing more first aid information, which can help with early diagnosis and timely intervention. This is in a way that when you get a problem, you can easily get first aid from our application, and you're guided easily on how you could go about particular issues. Then we have affordable healthcare. You see that the healthcare is in your hands because an application will be on your mobile phone. You don't need to pay off people. You don't need to pay to consult from doctors. And it also has insurance integration, where you can use insurance to access the services such as meeting doctors online and getting medication. Then we have supporting English and Swahili for diverse populations. As my colleague Victor said, many people in East Africa are using Swahili. That is to say Tanzania, Kenya, even Ugandans, we are picking up. So this broadens the reach of our application to more people within the East African society. And going on to my next part, which is the literature review. When we reviewed our literature, we realized that in Uganda, we are having some platforms that are operating, such as Rocket Health, and we realized that many of them they are limited to offline functionality. Then they also don't support multiple languages. Many of them are using English, and they don't have insurance integration. You pay insurance like on another platform, and also the telemedicine app is working on its own, such as the Rocket Health, and also this it looks so we look at improving this offline functionality to go and also cater for the people, the users that are using the app. The offline functionality in these platforms is for doctors. It's not available for the users, for these other people who are coming in for treatment. So we are looking at our application providing medical services to such people in the comfort of their homes. Then it also hinted on the use of AI, which will help to have more conversations or more live conversations with the users, where we have a user interacting with the chatbot and providing what they feel or the sicknesses and illnesses they are feeling, and the chatbot is able to give them a hint on what they may be sick of or the help that they need to acquire. Then the affordability part, we have talked about it. Then it is also, we realized it is going to help with the virtual sensitivity, since the previous applications that are available are not supporting the common language that we have in Uganda here and in East Africa. If we implement Swahili, then it will cover more people using the app. That will be the end of my presentation, and I would like to invite the next speaker to continue with the remaining part.
Yes. My name is Macheta Collins. I'll be taking you through the methodology, the development methodology, and evaluation plans. So the methodology, will be using qualitative methods as well as quantitative methods to find out exactly what we need to develop for the app. Because we need to know before we even start developing the app, what is lacking, what these people in this industry are facing, what challenges they're facing, and what we can do to solve it. So qualitative methods include interviews, focus groups, which are where we collect all the people involved, medical practitioners and patients. We collect them and talk to them, and they tell us about the experience in getting health services. Quantitative methods will be surveys where we can hand out questionnaires, and from there we can get numbers, we can get percentages on the number of people facing a certain problem versus other problems. The target population of this app will be healthcare providers. This includes the doctors themselves. This includes the hospitals or health service centers that are providing these health services. It includes the patients, obviously, because it needs to cater for, it needs to think about how patients get access to health services, as well as how health providers provide these services. It will also think about telemedicine and mobile app development experts. Yes, we need to know, because there are already people in this space, and we need to know what challenges they're facing and what they want to improve and what they wish they had in this space, these experts. Data collection methods include interviews, focus groups, and online surveys. That is where we talk to people. Online surveys. Data analysis methods include thematic analysis, descriptive statistics, inferential statistics. This is where we get the different statistics and find patterns within them, different patterns within them. Ethical considerations include informed consent. Since healthcare is a very sensitive subject, it needs to involve consent. The people using the application need to know what they're signing up for. It includes confidentiality and data privacy. Yes, healthcare is very sensitive and data needs to be secure. Which development methodology are we using? We're using the system development, the software development lifecycle, which includes project planning, analysis, design, implement, scope, language, and resources. Before we need to start, we need to come up with the goals for the application. Step 2, we need to collect requirements from the clients and the necessary stakeholders. That's the target population. Then we need to design the user interface, the databases, the system, the backends, and all other functionalities of the application. Then implementation, which is development, actual coding, and testing of the application, and support. Once the application is done, we need to support the patients and the healthcare providers as we get feedback. What is our evaluation plan? We have two categories: qualitative methods and quantitative methods. Qualitative methods include user testing and expert reviews. User testing is where we watch users, mainly the patients and the healthcare providers, as they use the application and get insights into how they feel or how they use the application. Quantitative methods include data analysis, usage data analysis, and user satisfaction reviews. Let me pass this last segment to Ian Oskar.
Okay, thank you. So just to sum up everything that has been presented, the importance of this app is to address the core issues in our health sector, which go back to the lack of accessibility to healthcare systems, also the very expensive nature of healthcare at the moment. And we hope that by leveraging AI and project development and software development, we can push the current health situation to a better level, in that we can genuinely solve these problems and be able to create better health for everyone. Thank you so much.